on to moving right along. Hopefully, getting information that you need. So when we're talking about infectious disease, we have come a long way when it comes to infectious disease and talk about it the last couple of years that we've had with the pandemic. The chain of infection. You guys remember that from microbiology? When there's a break in the chain, that's the problem. Of course, hand hygiene is the best. One thing is patients who are more susceptible to infection is because of they have had comorbidities. Their systems are fighting another type of disease, stress, lack of sleep. All of that makes patients more susceptible to other infections or exposure with that chain of infection. Collination, infection, and disease are three of the words that refamiliarize yourself when you're talking about infectious disease. So collination is the host has no interaction with the cootie itself. That's where you see a lot in chest x-rays where they have, for example, granulomas. Granuloma is usually TB, like a peanut M&M, where the TB is the peanut and there's a coating around it. When the patient starts showing signs of other disease processes, that granuloma starts breaking apart, or the outer coating, like the chocolate, and then that's where the patient actually shows signs of infection, because now their host is exposed to what they have. So they could have been healthy adults, been exposed to TB, the granuloma, no problems with it, and then once the patient has other debilitating disease processes, the TB, or same thing happens with like MRSAs and things like that too, as they become encapsulated. I think of it as a subdivision, and then once the subdivision and the kids in the subdivision go out, that's when they start spreading stuff. So it's kind of the same thing. They're inside and then they go out. Nothing against subdivision. I'm not trying to put any subdivision down. I'm just saying. And then disease is where the patient is showing decline. So they actually have a disease process itself. Isolation precautions, again, you guys probably have been beat up with these, especially in our COVID world, right? You know, before we never even walked down the hallway with any PPE on at all. Couldn't even come out of the room like a step and you would get in. Don't come out of that room with the gloves or mask on. And now, I mean, look at us. We've come a long way with that. So the airborne to droplets, the negative pressure rooms, the contact precautions, those with C. diff, etc. So with hand hygiene, of course, is the best way we can do it. Hand hygiene, can't stress it enough, right? Standard precautions, protecting yourself as a whole. Treatment for fevers, usually we don't medicate until the temperature is what? What? 101 is usually the magic one. Yeah, usually the magic number is 101. So if you have a patient that's in the high 100s, 100 point something, usually you start kind of think about, maybe I should. Because below grade temps are kind of a good thing because the immune system is fighting whatever's going on. But once they reach that 101, it's a bigger problem, right? And so we want to prevent anything, and then we give them the antipyretics. Acetaminophen, of course, is one of the best choices. So just familiarize yourself with the airborne, the droplets, and the contact, just for grins and giggles. So again, standard precautions.